There's a call for the enforcement of immunization in the elderly population. This is to prevent potentially life-threatening conditions like pneumonia. Shamala Pullen explains in the health report.
Pneumonia is inflammation and fluid in one's lungs caused by a bacterial, viral, or fungal infection. The condition is quite common in Jamaica.
The mild disease, you have a fever, you have a cough, you feel unwell. We love to use the word sputum. It just means that the cough is productive. You're bringing up stuff. And I'm always excited about the color of the sputum. What color? Because that tells me this is infected. So usually those symptoms, not feeling well, the fever, the cough, and the sputum, that's the first clue. Then it gets a little bit more serious now. Everybody has a pulse oximeter. Everybody is aware of how to use a pulse oximeter. My oxygen levels start to drop. Alarm bells. Seek medical advice.
Persons can also get hospital pneumonia while in hospital or healthcare facility for another illness or procedure. Those most at risk are people over the age of 65, children under the age of 2, as well as persons living with a lung or heart condition. Treatment depends on the cause and how serious the case is. Antibiotics, antifungal, and antiviral medications are usually used to treat the condition.
The other thing that I should mention in managing pneumonia, a lot of our patients today, as our medicine has expanded, as our medicine has gotten better, we are on some serious drugs out there for either for treating autoimmune disease or for treating cancers. Any patient who is on any of these drugs to treat either their lupus or their rheumatoid or their kidney disease or they are getting chemotherapy, those are special patients.
The condition is potentially deadly, which is why prevention is key.
What we need to do is to be vigilant that our old people get their pneumococcal vaccines to reduce their risk for pneumonia. They should have their flu shots in order to reduce their risk for a viral pneumonia. And they should also get their COVID immunization. So in speaking about the age groups that are most vulnerable, the elderly have a little fallback on to give them protection, and that's immunization. So we need to preach that more in our population, that they are properly immunized.
And remember to always seek the advice of your healthcare provider with your health report. I'm Shamala Pullen, wishing you good health.